First of all, I would disagree with the statement that this is not a life and death disease, because this is death of the retina. And the retina is your window to the world. It's the way that most of us interact with people. We through visual means. It's a way that we learn things in school. It's the way that we interact socially with people. It provides us opportunities to learn and to enjoy art, to enjoy paintings and visual things, and to enjoy our environment and the beauty of nature. And I think it's just psychologically devastating for people to be able to see when they're young, and then to have their vision slowly disappear, and to be aware of that. And so I would disagree. I think it's I can't think of, except for having cancer and being told that you're going to die from that, or that you have a high chance of dying. I can't think of anything else that would be so upsetting.
We are in the right place at the right time, and we're in the middle of a miracle, and we are actually creating the miracle. The miracle began with Gordon Gund, and 40 some odd years later, here we are. He's my hero because despite his wealth, despite his stature, he is everyone's hero. And I mean that from the bottom of my heart. He basically takes care of everyone like a family member, and he has affected single-handedly tens of thousands of people's lives. And really, we all follow him.
We're at a point now where there are so many quality potential projects that are being thrust upon us that we don't have enough money to fund every one of those research projects. And that is, it's very upsetting at times. It's very frustrating at times, especially from my standpoint, being the head of the development committee. My responsibility is to try and raise more funds. And we know there's a finite amount. We're pushing the limits to try to get as much money into the foundation as possible, because we know that the promise of the research and the clinical trials is so close. But of course, the only thing that stops us is the ability to pass those funds on to the researchers.
We really wanted to do this for a long time. We went to many different groups looking for support, and including large pharma, and they would all say, wow, isn't that data in the dog models, isn't that incredible? Wouldn't it be great to do that in a child? And then they would say, well, how many people are there with this condition in the United States? And we'd say, well, perhaps 350. And they'd say, okay, too bad. So the foundation really has been the one group all along that has supported development of new treatments for these rare disorders.
Looking ahead, development of treatments for single gene diseases, gene therapies, is accelerating. More young people are getting into the field. They see it's possible to do. The main issue is how do we keep funding them? Because there's more and more of them that are becoming possible. They all treat a relatively small population of patients, but what's happening now is that some large companies are seeing that, well, there's only a few patients for this disease and that disease, but if we have a template, a way to move them forward along the same pathway, and they really are essentially the same pathway, just the gene is different, that it is something that I think large pharmaceutical companies will become interested in. So I think as far as gene therapy goes, there's going to be an explosion over the next 20 years.